All right, so complications of diabetes. So, increased risk of heart attack or stroke. Why? Okay. Again, if the tissues aren't getting the sugar, they're not getting the energy, they're going to get damaged, they're going to get hurt. Kidney disease, failure. That has to do with blood and blood flow. And again, the tissue's not getting the nutrients, loss of sensation, tissue breakdown. Again, that has to do with the neurons. If the nerves are not getting their energy, yeah, poor wound healing, vision loss, blindness, sexual dysfunction, gum disease. So things, again, it seems simple. What's the problem? Tissue's not getting sugar. If they're not getting sugar, they're not getting energy. Not getting energy, complications. Okay. And then, of course, there's complications with blood flow and circulation too. Risk factors for type 2: overweight, obesity, diet, lack of exercise, chronic stress, genetic factors. Some people are more genetically predisposed. So we hear about diabetes with people of color. That happens. So people, African American descent, people of Latino descent, people, Native Americans, right? So we see these disorders or these diseases. Controlling diabetes, this person actually has an insulin pump. It's kind of really neat. I had a friend who had type 1 diabetes, and so they're not making insulin. You have to have insulin. So one way is to keep getting injections. And something I never thought about. Imagine if you're like getting shots constantly. Usually it's in the belly, okay, soft tissue. Well, they develop scar tissue. And then so they have to move around their belly. I know that sounds silly, but that's the reality. So one way to get around that is this thing called an insulin pump. It's like a direct route into the blood, and this person just goes up and down, manages their insulin. So for a person that has to have insulin injections, this might be a good way to go. Clinical management for people who are type 2. Well, okay, so glucose monitoring, of course, you got to check your blood sugar. Weight loss, it really helps. With type 2 diabetes, you can reverse that. The body can reverse, okay, with good diet and exercise, okay? Weight loss, exercise. There are oral medications. There is insulin therapy also. All right, so that finishes up diabetes. It's a problem for a lot of the people in our nation. It depending on the type. Type 1, there is no cure. Type 2, there is a cure. And type 2, diet and exercise, eating healthy, laying low on the sugar, exercise, losing weight really helps. Type 1, unfortunately, we don't have a cure as of now. All right, cardiovascular disease. Cardio, we're talking about the heart. Vascular, we're talking about the vessels. Large CVD, okay, cardiovascular disease. Large group of disorders affecting the heart and blood vessels is the leading cause of adult mortality in the United States, responsible for more than 3 in every 10 deaths. Okay, so that's a lot of people. If we look at it, coronary heart disease, that's out of the CVD, out of the cardiovascular diseases, what percentage of CVD deaths? Coronary heart disease. Think about your old ticker, okay? From a few weeks old to the rest of your life, that heart has to pump, okay? We don't think about it much, but it's doing a lot of work. So if it's compromised, okay, having an unhealthy heart can be really bad, okay? Other cardiovascular disease, stroke, that's an issue with the brain, blood flow to the brain. So do the blood vessels get clogged or do they burst, okay? High blood pressure, okay, that's linked. It can cause issues with these. Heart failure, disease of the arteries, okay? So these are some of the issues. So some terms: arteries, they are the vessels that are taking blood away from the heart. That's artery. Veins, they are the vessels that bring blood to the heart, okay? So arteries away, veins to. Blood flow to the heart is veins. Blood flow away from the heart is arteries. Myocardium, myo means muscle, cardium, that's the heart wall. The heart is, when you look at pictures of the heart, it's hollow. It's a hollow organ. And the walls, they're made out of muscle. So the myocardium is the muscle. And it's a pump. It's like boom, 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 boom. All, you know what? I'll put on a video so you can see that. It's kind of really neat to see how the heart works. Atria are the two chambers up top. Ventricles are the two chambers underneath. So it's a four-chambered heart for us. Not all animals have a four-chambered heart, but we do, okay? This is kind of a weird picture. I don't know why. It kind of freaks me out. You know, she's all, what? And then you're all, what? Okay, so here's the pump. See, it's hollow, right? So the blood comes in. The blue is for deoxygenated blood or low oxygen. It's blue. And that's why in your veins, they look blue because there's low oxygen content. The veins bringing blood to the heart pumps. The blood goes to the lungs. In the lungs, that's where it gets its oxygen. It gets oxygenated. The oxygen-rich blood comes back through the aorta to the head, to the arms. The aorta makes a U-turn to the abdomen, to the legs, okay? So the heart is the pump, and it's pushing blood to all of the tissues. These are the major arteries, major veins. And again, the arteries take blood away from the heart. Let's pretend we're gonna take nice oxygen-rich blood to your toes, okay? And then in your toes, that's where the oxygen will go to the tissues. Now the blood's coming back, okay? Back to the heart, back to the lungs, get oxygenated, blah, blah, blah. Every minute, okay, about every minute, all of your blood is being circulated in your body, okay? So the heart, that little ticker, is doing a lot of work. Capillaries, the smallest blood vessels which deliver blood, nutrients, and pick up wastes. So here, you know, if we're talking about your toe, the capillaries, that's where the oxygen would go to the tissues, and then the waste products would go into the capillaries, then go back to the veins, okay? Blood pressure, literally, it is the physical force. Imagine if this is a vessel, the pressure on the vessel, okay, that's blood pressure. Okay. So all the issues that can happen with the cardiovascular system. The walls, imagine this is a vessel. Think of it as a plumbing, right? The pipe, here's the opening, it's called the lumen, okay? The blood's flowing through. What if you have a bad diet, okay? Plaque, we call it plaque, can clog up the artery. And look at this. Look at all the blood that can flow through here versus here, okay? So the diameter gets smaller, so less blood can flow through. And not only that, that can increase blood pressure because now we have a smaller place for blood to flow through. That puts more pressure on the vessels. What's wrong with high blood pressure? What's wrong? Right? The vessel can burst. That's a problem, okay? So atherosclerosis, a condition characterized by narrowing of the arteries because of inflammation, scarring, buildup of fatty deposits. We know fat's not good. Excess is not good. Inflammation is not good. There's a link between inflammation and damage and scarring and going from this to this. And sometimes when someone has a heart attack and you hear about coronary artery disease, coronary is the heart. Well, the heart is this muscle. The heart itself has to get blood supply. Well, what if the vessels feeding the heart are clogged? Okay, and that's what they're talking about, coronary bypass. Literally, it could be so clogged where this is how big this space is. And then you can imagine how the heart would have a hard time because now the heart, the pump itself, is not getting adequate blood supply. Hypertension, high blood pressure, a persistent state of elevated blood pressure. Signs and symptoms, none in most people, hence the silent killer. Okay, most people who have high blood pressure don't even know it. But it's damaging the vessels. It's causing problems, okay? Long-term effects, other forms of CVD, vision loss, kidney disease, lower capacity to think clearly and learn. Because if blood is not getting to the tissues are going to get damaged. Hypertension is generally a result of many contributing factors: age, weight, ethnic background, diet. Clinical management, low sodium, okay? Sodium helps increase blood pressure, okay, because it helps retention of fluids, which gives more blood pressure. Exercise is so good. Don't smoke. Smoking damages the vessels. The chemicals in smoke damage the vessel. Drink in moderation, okay, medication management. Coronary heart disease, also called coronary artery disease. Plaque in the coronary arteries build up to the point that it impairs heart's ability to function. Single leading cause of death in the United States. Angina pectoris, that's chest pain. Sometimes people get chest pain, and those are warning signs, okay? Chest pain due to coronary heart disease. Angina is not life-threatening, but it does signal greater risk of a cardiac event. Myocardial infarction, that's a heart attack. If you've ever heard myocardial infarction, that's a heart attack. Cardiac crisis in which the region of the heart muscle is damaged, destroyed by reduced blood flow. The muscle, okay, it's made out of cells. And if they're not getting blood, they can die. And that's a heart attack, okay? From what we know right now, when heart tissue gets damaged, it does not fix itself. It does not regrow, okay? We're using stem cells, and there's stem cell research, and we're getting good results in some cases where the cells can get fixed. Arrhythmias, you've probably heard about that. When the heart is not beating regularly. Bradycardia is slow arrhythmia. Tachycardia is fast. So if the heart is beating slow, it's bradycardia. If it's fast, it's tachycardia. Both not good, okay? Sudden cardiac arrest, life-threatening cardiac crisis marked of lost heartbeat, unconsciousness. So if someone passes out, and they have cardiac arrest, that's the idea of CPR, okay? You're putting compressions. It's kind of a really weird thought. You're putting compressions, that's to help squeeze the blood, okay? And with the lungs, and you're kind of doing the job of the heart when you're doing those compressions. EKG or ECG, electrocardiogram, test that measures the heart's electrical activity. They put these nodes around, right, the chest, and every time the heart, before it beats, there are specialized cells in the heart that release electrical impulses. And those it's not much, okay? But those little electrical impulses can be picked up. And that's what the EKG does. It picks up the electrical impulses, and then, diagnostics can be done where we see, are the electrical impulses going through the heart properly? Are they going slower? Are they going faster? Are there any issues through the conduction system? Okay. What are signs of a heart attack? By the way, men's signs are a little different than women's. And there were times where women would die because they would have these signs and the emergency room wouldn't pick up that they were having a heart attack. Okay, what's some of the signs? What have you heard of a heart attack? Sweating, tons of sweating, pain, not necessarily pain. They talk about pressure. Well, there is pain. There's pressure. A lot of times people talk about it feels like an elephant is sitting on their chest. Okay, that's not good. Okay. Lightheadedness, pain across the center of chest, pressure, fullness in the chest, pain or discomfort in the arm. Sometimes you hear about the arm, shortness of breath, cold sweat, nausea. Sometimes they're vomiting, okay? All of those could be signs of a heart attack. With women, some similarities, some differences. Lightness, dizziness, fainting, shortness of breath, cold sweat, pain, pressure across the chest, pain, pressure, squeezing, fullness, pain, discomfort, arms, back, jaw, abdominal pain, nausea, vomiting, weakness, extreme fatigue. So sometimes women do not, when they end up in the emergency room, they might not have those characteristics of a heart attack, of that pain in the chest, and they might be misdiagnosed and they can die. So now our health professionals are recognizing that. Myocardial infarction, cardiac crisis in which the region of the heart muscle is damaged, known as a heart attack. Stroke. What is a stroke? That's if there are issues here in the brain and blood flow in the brain right? So medical emergency in which blood flow to or in the brain is impaired. Ischemic stroke, stroke caused by blocked blood vessel. So if the blood's not coming to the brain, now the brain cells can get damaged. Hemorrhagic stroke, if the blood vessel bursts, that's a hemorrhage. Now, again, the tissues are not getting their nutrients. Transient stroke, a temporary episode of stroke-like symptoms indicate high stroke risk.